here today with Dr. Ruth Wilson, one of the co-chairs of the Advancing Rural Family Medicine Canadian Collaborative Task Force. Welcome, Dr. Wilson.
Thank you.
Can you tell us what is the task force?
Well, it's quite a mouthful, isn't it?
It sure is.
Yeah. Well, it's an exciting project. It's a joint venture between the College of Family Physicians of Canada and the Society of Rural Physicians of Canada. And what we're really aiming to do is improve rural health care and the status of the health of rural Canadians. And of course, because we are the College of Family Physicians and the Society of Rural Physicians is a society of rural physicians, we think that doctors and doctors in rural areas are a big part of the solution to rural health care. So our work is to try to find ways that we can educate, recruit, retain doctors, particularly well-trained family medicine, rural generalist doctors in rural parts of Canada.
That's great. Can you tell us some more details about the type of work that the task force is undertaking?
Yeah, so it's a joint task force, and you know, Canada's a big country with a lot of geography, and our population is lined up along the U.S. border. But we need still to serve the 10% or more of Canadians who live outside the major centres. And there have historically always been difficulties in adequately staffing some of the communities in Canada, and there historically have been difficulties finding doctors who have the clinical courage and the competencies to undertake the challenging practice of rural family medicine. So our aim, of course, is to come up with an action plan for what we can do to support family medicine education and recruitment and retention. So what are we doing? We have a variety of important foundational pieces of research that we're doing together on this task force. The first is we just did an environmental scan just to find out what's the status of rural family medicine at the moment. How many training programs do we have? How many rural family doctors do we have? What's the mismatch? So an environmental scan of how we're doing across the country. And the good news is that there's increased interest in practicing in rural communities, and the supply of family doctors feeling equipped and confident and ready to practice in rural Canada is increasing. So that's an example of the first piece of work we've done. Then we've been doing some additional pieces of research. We've been working with Memorial University to talk to doctors who have been recruited or have settled in rural communities, doctors who've left rural communities, to try to find out what are the factors that attracted them there and have kept them there, or what are the reasons that they chose to leave. I think we're finding that many of the factors are ones that you might predict. An important one clearly is the doctor's partner and whether he or she can find a supportive community and meaningful work. We've also had some very interesting discussions as part of our foundational research with policymakers in the federal government, the provincial governments, and the territorial governments. And of course, ministries of health in those jurisdictions are really keen on finding out what might work and what might not work. So we've done a policy scan of the kinds of things that territories and provinces are doing. We've also been talking to communities, so small communities and also Indigenous communities, to see from their point of view what is it that they have to say about trying to find doctors, trying to keep doctors, trying to find doctors who are a good fit for their community. So those are some of the foundational research pieces that we've been working on so far.
For those interested in learning more, where can they access information about this?
Well, in December we'll have the full background paper, which has quite a lot of the data and findings that I've told you about, which will be released in both official languages. But for now, we have an executive summary, which is available on the college website if people would like to see some of our preliminary findings.
Great. And why do you think the work of the task force is so critical at this time, and how are physicians playing a role in this?
Well, it's critical, of course, because people who live in rural Canada need good care, and we think that a well-trained family medicine is the kind of rural generalist physician who can really serve the community's needs best. So, for example, I myself have practiced for a number of years in remote and isolated parts of Canada, and in communities that perhaps can only support 4 or 5 physicians because of the population base. they still need physicians who can do emergency room work, deliver babies, look after inpatients, do an office practice. They need people who have a whole range of procedural skills and also good diagnostic skills at helping out in their own communities. So that really well-rounded generalist family medicine training is so important. There's some who feel our family medicine training programs need to do more to prepare family doctors to take on those many roles, and so that's an important part of what we're looking at. But the most important reason we're undertaking this is to ensure that we have a good supply of well-trained people, well-trained physicians who are ready and willing to take on this work.
Great. And so my last question for today, what's next for the task force?
So we have a great deal of work to do in coming up with our recommendations, but we're determined that our findings and our recommendations not be a report that sits on the shelf. So we're very eager to communicate with, be in relationship with those who have the ability to change educational programs, change policies, change financial incentives, change the way that communities welcome, support, retain physicians. And so we'll be looking for partners to help us shape the recommendations but also disseminate them. We're expecting that we'll have a summit in 2016 where we'll bring together interested parties to help in the work of examining the recommendations we come up with and then see what part they can play in helping to make sure that rural Canadians have access to really high-quality family doctors.
Great. Well, thank you so much, Dr. Wilson, for joining us today and sharing the important work of the task force.
It's a pleasure.
And thank you for watching FMF Today.